Welcome back to Morning Joe. With President Biden's July 4th vaccination goal looming, health experts now are sounding the alarm about the so-called Delta variant of coronavirus. NBC News correspondent Blayne Alexander has the latest on the race to get more Americans vaccinated.
Experts predict the Delta variant, first discovered in India, could soon become the dominant COVID strain in the U.S.
It is more transmissible and possibly more dangerous in terms of causing severe disease.
All of it only accelerating the rush to get Americans vaccinated. But the Biden administration is running out of time to hit its July 4th goal, 70% of Americans with at least one shot. So far, only about 53% of the country is partially vaccinated. But some states are barely hitting a third of their population, the lowest rates in southern states like Georgia, Alabama, Louisiana, and Mississippi, where only 28% of the state is fully vaccinated. A new poll gives some insight into why the rates are lagging. 37% of those asked point to vaccine hesitancy, but nearly double that number say they faced barriers in trying to get the shot. And even as scenes like these are becoming more familiar, Dodger Stadium hosting the largest sports crowd since the start of the pandemic, still some setbacks, with a Royal Caribbean cruise ship forced to postpone setting sail after 8 crew members tested positive for COVID.
On one hand, we're seeing a number of states loosening restrictions, but on the other hand, we're hearing this dire warning about the Delta variant. Is this a confusing message?
Well, Blayne, I think what you're hearing is really a message for two different populations, which is that if you are vaccinated, you are still in good shape. But if you are unvaccinated, there's still reasons to be cautious, to still wear a mask, to still avoid indoor gatherings.
NBC's Blayne Alexander reporting there. Joining us now, former Biden White House senior advisor for COVID-19 response, Andy Slavitt. He was a key architect in crafting the Affordable Care Act as well under the Obama administration. Andy's out with a new book titled Preventable: The Inside Story of How Leadership Failures, Politics, and Selfishness Doomed the U.S. Coronavirus Response. Andy, good morning. It's good to have you with us. We'll talk about the book in just a moment, but you're only about a week or so out of the job running the coronavirus team inside the White House. So tell us what you know about this Delta variant. Obviously, we've heard from public health experts and officials who said the answer to this is to get vaccinated because the vaccines are effective against it.
Yeah, look, I think we should think of this as COVID on steroids. You know, if before you walked into a room and it took you 10 minutes to get exposed to COVID, now you could get exposed in something like 5 minutes. So if you haven't been vaccinated, you should be worried. And it's another reason for you to talk to your doctor and ask them about getting vaccinated and ultimately to get vaccinated. If you have been vaccinated and if you live in a community with large numbers of people being vaccinated, that's exactly why you're vaccinated. And you should feel good and you should feel safe about the Delta variant. And feel fortunate that, unlike the rest of the world, we have abundant vaccine supplies here.
Obviously, you and your team and President Biden set that July 4th goal to get 70% of eligible Americans vaccinated. How is that goal looking, and what's the significance of that number from your point of view?
Here's how I'm looking at it. I think we're probably, as a country, going to be very close to 70%. If we're short, we'll be at 68% or so. And then we won't stop. We'll keep moving beyond that, and I think we'll eventually soon cross 70%. But here's the point, and I think you made this point very well, Willie, which is that doesn't mean the whole country is 70%. It means parts of the country are at 90%, and parts are at 40 to 50%. And so those parts of the country that are 40 to 50% are at risk, particularly come fall, should we see a new rise in variants, and I think you can be sure that we will.
Kathy, I know you have a question, but first, you were talking about real fears about this variant in Britain across the country.
I mean, it's already postponed the reopening in the UK. They've had to push it back for a month because of the Delta variant, and they're worried about it spreading very fast and both being more transmissible and potentially more dangerous. So it's already had an impact in the UK. And Dr. Slavitt, is there a possibility that Delta, given that we have some areas of the country with low vaccination rates, and of course we have children not yet vaccinated in this country, could we see stresses on the healthcare system in some states because of Delta?
I'm not as worried about it. I think there's one thing we did differently than the UK, which is we required 2 doses. Right. And for all Americans who've gotten 2 doses, they have a higher boost in immunity. The UK pursued a strategy of getting more people vaccinated more quickly by giving people 1 dose. The reason that Dr. Fauci and others decided that that was not the right idea was precisely because of variants, because you need the extra boost when you're facing something that's trying to evade the immunity system like we see with Delta.
Hey, Andy, it's Jonathan Lemire. Certainly at the G20, there's a lot of discussion about this and the commitment made for 1 billion doses worldwide, though there's some groups that say that won't be nearly enough, that it could need to be 10, 11 billion in order to eradicate the pandemic by the end of 2022, which I know is the goal. But I wanted to hopefully get you to talk a little bit about your book and take us a step back, in particular that sort of fragile time, very fragile time in terms of presidential transition between the Trump and Biden administrations, and what sort of setbacks and obstacles you experienced there as you came in as part of the team that then took hold of this nation's pandemic response.
I think one of the major differences and one of the ways that we were so fortunate is we as a president that came in with a big focus on accountability. He wasn't going to avoid accountability. He wasn't going to pick fights with governors. He wasn't going to blame states. Basically, his approach was we're going to get it done. And I think as we saw from Donald Trump, and I think this is outlined in the book, Preventable, Donald Trump did everything he possibly could to avoid accountability, whether it was that meant denying that the virus existed, denying the seriousness of the virus, pointing fingers at blue state governors, pointing fingers at China, going through the summer and systematically removing anybody with a scientific point of view that differed from his narrative. So the job is a lot harder to execute when you have a boss who essentially wants to deny the problem. You know, we came in, and I think one of the reasons President Biden was sitting in the Oval Office is because he said we are going to take this on and we're going to beat it and we're going to be accountable. We're going to set goals, and when we beat them, we're going to set new goals. And that's what we did. And that's why we were able to deliver more for the public.
The book is Preventable, the inside story of how leadership failures, politics, and selfishness doomed the U.S. coronavirus response. Andy Slavitt, thank you very, very much.
And Casey, to show just how serious this is, how leaders in Alabama understand how serious this is. You had Tommy Tuberville doing something that surprised a lot of people, getting on, doing a public service announcement saying, hey, Alabama, get vaccinated.
Yeah, we call him senator now, but I think his more important role is, of course...
Oh, did I call him coach?
Coach. No, you did not. I'm saying, like, we name him as senator, but in that video, it's the most important title that he's ever had was coach.
Yes.
Because there
In
are so
Alabama,
many people who know him for that. And yeah, I mean, and good on him for doing it. I mean, there are so many people who haven't or won't. I mean, even former President Trump has basically refused to. And when he does even mention the work, he mentioned it at an event he held semi-recently, and there was silence from the crowd, right, which shows how this has gotten so incredibly politicized. So, you know that a lot of these Republicans who, if CNN did a survey of all of them in the House, and a whole bunch of them wouldn't even say whether or not they were vaccinated. And you know that they are, but they've decided that they're going to take the easy political way out.
Whether it's television hosts, whether it's Republicans, you just look at doctors. I think the latest number, 96% of doctors, Eugene, have gotten it themselves.
And it's so unfortunate because when you look at the demographics of those who have not yet been vaccinated, many of them are in these voting blocs that support many of these Republican lawmakers. White men are behind the national averages in getting vaccinated. And so having these lawmakers speak out could be really beneficial in the long term.
Makes a big difference.
Still